40 million people in the US suffer from seasonal allergies and 20 million have asthma. But guess what, folks? You do not have to suffer.
Good, tell me more about that.
Dr. Sumita Khatri is co-director of the Asthma Center at the Cleveland Clinic. She's an expert on allergies and asthma. So what is asthma?
Asthma is a chronic lung condition which shows up with shortness of breath, wheezing, cough, and chest tightness in periods.
Triggers can include emotions, stress, dust, and of course, allergies.
Itchy nose, sneezing, runny eyes.
All symptoms of allergies, which are also called hay fever, pollen allergies, spring or fall allergies.
About 50% of patients with asthma have allergies as well, and so it's a big contributor to asthma.
Often it develops in people who have had a lot of allergies as children.
There seems to be something in the body that's triggered by the allergies that makes asthma more likely, but not everybody develops asthma. See, asthma is very different. I mean, asthma is not one thing. It's a big variety of things. Like each person with asthma has almost a different form of asthma.
So how can people control their allergies and asthma?
Staying fit, staying healthy, eating nutritious foods, those things help you be able to fight off some of the allergies and the impact asthma can have on you.
And this time of year, a good spring cleaning can work wonders.
It's a good time to open up the windows and get some ventilation. You've been inside, there's a lot of clutter, there's a lot of dust, there's a lot of allergens.
One caveat to the spring cleaning advice.
If anything smells too strongly, that's probably a hint that it's not good for you. You don't want to use strong bleaches or even things with a lot of aromas. Just the very basics, the stuff that they used to use in the olden days. The less smelly, the better. I mean, we like that clean smell, but it's probably not so good for us.
Declutter to cut down on dust in your home, avoid secondhand smoke, and of course, if you do smoke, try to quit. If you're allergic to pets, try to keep them out of your bedroom. And how do you know if it's allergies or just a cold?
It's miserable when you're sick, but it'll go away. With allergies, it's very similar symptoms, maybe less in the throat, but more in the eyes and nose, and it just wears you down and doesn't really go away until the season's over. If you're not feeling relief within a week or two, it's probably either a good time to go back and see your primary care provider or be referred to an allergist for evaluation for allergies. Also, if there's any signs or symptoms of these periods where chest tightness happens, cough, shortness of breath, there's absolutely no need to suffer. I mean, really mention this to your caregiver and get tested for asthma.
And if you do know it's allergies, obviously do your best to avoid what you're allergic to.
Ultimately, if you can get away with avoiding them and feel better, it'd be a lot easier than sort of being drugged up with the antihistamine.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.